All right. All right. Go ahead and share my screen. Give me 1 second here. Okay. Oop. There we go. Everyone's seeing that. Cool. All right. Hi, everyone. Thank you for joining today. So we're going to be talking about gambling from a public health perspective today. And I'm sure most of you know, it is Problem Gambling Awareness Month. So this is a timely conversation we're having. And I mean, tomorrow, actually, I don't know, it's this week, right? March Madness starts. So definitely a timely conversation. We're not going to be talking about sports betting per se today, but it's definitely on people's radar. So yeah, we'll go ahead and jump in. So just a little bit about myself. I am the prevention manager at the Connecticut Council on Problem Gambling. I have a background really in nutrition and wellness. That's my bachelor's is in nutrition, but I've held various roles in prevention. So I was previously working in diabetes prevention, worked in substance use prevention, really before jumping over to gambling prevention. And I do have my master's of public health. And yeah, this is an area that I feel like people who work in gambling and are in this field specifically, I feel like we know it's a public health issue. But I do feel that some people maybe that aren't, doing this day to day might not recognize it, especially when we look at some of those systems like the Department of Health and Human Services, and we'll be jumping into that in the full gamut today. So yeah, that's just a little bit about myself. So these are our learning objectives for today. So I'm assuming that many of you have already participated in the 3-part TTASK training. It's kind of Gambling 101. That's put on by Caitlin Brown, my colleague, and Kelly Lepard, who's here too. So we are just going to be briefly laying the foundation of the gambling landscape in Connecticut. It'll be a review for a lot of folks. And if it's not, it'll just be nice to set us up as we start to talk about some of those public health frameworks. We're also going to be identifying comorbidities, high-risk populations, and the impacts of gambling-related harm. Like I mentioned, we're going to be talking about public health frameworks and how those really relate to gambling. And why, like I mentioned, that this should be considered a public health priority. And hopefully you all leaving this presentation will be able to think about incorporating gambling prevention in your community. We will have an opportunity at the end just to have a quick breakout, just to discuss a little bit of that after we go through some of the frameworks. All right, so again, if you've been through any Gambling 101 or any presentation on gambling, you've probably seen this definition. We always like to start just by giving the definition of gambling. So this is risking something of value on an activity with an uncertain outcome. And we really like to point out that something of value doesn't have to be money, right? So this could be when we're thinking of youth, like something in the student's lunchbox or, racing down the hallway or something like that. It can be, in the beginning, like an innocent bet. And then we also do like to talk about that uncertain outcome. And when we look at different forms of gambling, which we'll see in the next couple slides, some things that folks might not consider when we do think about that uncertain outcome, it is important to hold on to the definition. So as a reminder, in 2021 in Connecticut, we did see the largest expansion for gambling since the 90s when Foxwoods and Mohegan opened. And this really expanded online gambling. So we see online casinos now, online sports betting, fantasy sports. I feel like I've been saying online lottery is coming soon, but it really is coming soon. I think it's in the next few months here. We'll see that. And just a disclaimer, if people I've reached out because I was like, oh gosh, scratch tickets, will those be available? I don't believe scratch tickets will be available, but it will be things like Powerball, Keno, those types of things, folks will be able to purchase that cashless. So just will be another thing for us to consider as we're moving through this presentation and thinking about accessibility and risk factors as well. So types of gambling in Connecticut, we have the lottery. This is one of the older forms of gambling in our state, and it's still the most popular. I mentioned a little bit about some of those games that we could be playing, or scratch tickets, things like that. We have our brick and mortar casinos, so Mohegan and Foxwoods. And at our brick and mortar casinos, we now have FanDuel and DraftKings, which folks can go in person and place bets there, or they can do this online. Online gambling, obviously, those casinos, those online casinos like FanDuel and DraftKings, as well as Mohegan and Foxwoods, all have their own apps where folks can also be online gambling. They can be doing slot machines and table games. So that's an option. Off-track betting. So this is horse racing. These are places like Winners and Sports Haven. So folks can go and place bets on horses in person there. The stock market and day trading, which this is where, again, when we're thinking about that definition, I like to say about the uncertain outcome. And I feel like I get some pushback from folks that say, oh, that's not, oh, I never thought of that. And really, we don't know what the outcome of things might be. So that's certainly type of gambling in Connecticut. Charitable games, so things like bingo, 50/50 raffles, silent auctions, cryptocurrency. This is an area that it's dark web kind of stuff. But this is Bitcoin, Dogecoin, and that's a whole other different presentation, really. And then we have video games. So the convergence of video games and gambling. So these are things like loot boxes and skins trading and things like that. So yeah, this is what we have available here. So gambling is on a continuum, and really the big takeaway here is that 95% of the population can gamble as a recreational activity. So, that's really when we're thinking about prevention, and we'll see different forms of a continuum later on in the presentation. But when we are thinking about prevention, we really do want to be talking to that 95% of folks. That 5%, though, that's where we're seeing folks who might be experiencing gambling related harm, whether at that problematic or diagnosed with gambling disorder. And this is where we would like to just point out that, the folks that are more at risk. So youth, we know that youth are 2 times more at risk for developing or experiencing gambling related harm. Veterans are 3 times more at risk. Athletes are 4 times more at risk. Those who are experiencing substance use or mental health conditions are 10 times more at risk. And then the Department of Corrections and Criminal Justice population are 20 times more at risk. And I hope that folks are seeing just the full slide. Perfect. Okay. So, because sometimes there's a click through. So this slide is really just, to show that I think, again, when I'm talking to folks about substances versus gambling, and I know that many folks that are in the prevention world and they're working with the SPIF, we focus on substances. And this is really to show that the brain is affected the same exact way with gambling. So the only big difference here that you'll see is language. So folks that are experiencing substance use disorder might be looking or needing an extra dose or stronger doses to achieve that high, where in gambling, it's not self-limiting, so you can't be taking higher doses, but we certainly see folks increasing bets. So the number of bets they might be placing, or the amount of money that they might be placing on a bet needs to be getting larger so that folks can still achieve that high. And this is important to lay out because when we are looking at the Department of Health and Human Services, their health priorities and health behaviors that they are feeling that is a priority, we do see substances is one of them, and gambling is not. And you'll probably hear me say that like 10 more times. But just wanted to show that comparison. So here are some of the comorbidities. And so comorbidities are the presence of one or more additional health conditions occurring simultaneously with a primary condition. So folks might be experiencing depression, suicide, mood disorders, I believe specifically bipolar disorder, anxiety, substance use disorder, alcohol use disorder, tobacco dependence, and then some chronic conditions like diabetes, heart disease, and obesity. And we know that many, if not all, of these comorbidities are associated with problem gambling and gambling disorder, but these are public health issues. So I mentioned the Department of Health and Human Services. They have Healthy People 2030, which is an initiative that we'll be talking about, and many of these are there. So I just wanted to point those out. So here's some information about the impact of gambling on underserved populations. We know that in some cases, casinos and betting venues are placed in locations that are socioeconomically disadvantaged. And because of this, we do see an increase in folks developing a problem with gambling. We also see a link to those who may be working part-time jobs, experiencing more gambling-related harm. And we'll talk a little bit later about that as far as economic stability as a health determinant. But there is some evidence that shows that individuals experiencing gambling harm had lost their job due to the behavior. So risk factors, again, this is going to be a review slide for folks that have been in any Gambling 101 presentation, and we won't go through each risk factor. I just wanted to highlight a couple of risk factors that we should know, or that we do know would directly impact some of the social determinants of health. So some of those being accessibility, history of trauma, having a parent with a gambling problem, history of substance use and mental health problems, and financial problems. Okay, so I'm going to take a second. I don't know, Jen, if there are any questions that anyone has.
Nope, nothing in the chat.
Okay,
so if
perfect.
anyone has a quick question on any of that preliminary information, you could raise your hand. I think Mr. Downing has a question.
Hi, Paul.
If you'd like to unmute.
There we go. Yeah, the previous slide of underserved, not sure if I understand. I understand the point about having people exposed or accessible to gambling in those socioeconomically disadvantaged areas.
Yep.
But the word underserved to me means limited or restricted resources.
Yep.
So are you saying there are not enough resources in those areas?
Yes, so we'll be talking about that in length when we talk about the social determinants of health. So they all interplay with one another. So folks that are experiencing or are living in socioeconomically disadvantaged neighborhoods will have less access to resources, less access to healthcare, and there is research outside of gambling that does show that. But then, you know, we know that there's not a lot of research in gambling, unfortunately, right? But yes, that is, we'll be going into that a little bit more in detail. That was kind of just preamble. Yeah, sure. Anyone else?
Nope, I don't see anyone else.
Okay. So I'll need your help again, Jen, because in the chat, I would like folks, or I mean, you can come off of mute and raise your hand if you'd like to answer this, but how would you define health?
Yeah, just go ahead and pop them some ideas into the chat. I'll read them off, Mallory, as I can keep up them coming in, or if anybody wants to come off mute and share that as well. So how would you define health? Just things in your mind. A state of well-being, a person's well-being, thriving, well-being.
Yeah. So that word is, yeah.
Eight dimensions of wellness.
Yes. Yeah. I have 7 in here, but
Well-rounded.
Yeah. Perfect.
Well-rounded. Yeah,
Great.
these are great.
So yeah, I love when I pose this question. And this was a question that was posed to me in grad school that I just thought was so interesting when, hearing different perspectives from people. And I think that's the takeaway that, when we are considering working with many populations or people that have different ideas of what health can be, right? That idea can vary. So it really is important to consider our biases when we're working with other populations, because how we define it might not be the same as other folks. There's this idea of community-based participatory research. So, and this is really inviting the folks in that community to be at the table, which, again, working in prevention and capacity building, we know that that's super important to have those voices be heard at the table. So the World Health Organization does defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. So you all hit it right on the head on it's a state of well-being, I believe. So now for the folk that mentioned I have the 7 dimensions of health. And this is an iterative model. We've seen, 8, I've seen 5. So we know that wellness is a state of well-being. So you're going to see impacts of environmental, physical, emotional, intellectual, spiritual, social, and occupational. So in terms of gambling, folks who might be impacted at that emotional level may have feelings of reduced self-worth, feelings of shame, inadequacy, insecurity, and particularly vulnerable to mental stress and suicidal ideation. So we do know that individuals with or experiencing gambling-related harm do experience suicidal ideation more than any other substance. At the physical level, individuals might be increasing that sedentary behavior, right? So folks might be, whether they're in a casino at a brick and mortar location somewhere, or, on their phone now, sitting on a couch. That is something that we see. We also see that there's a biological impact of stress, right? So increased blood pressure, insomnia, and then also the increased risk of obesity. So this can lead to things like diabetes. And then for the financial aspect, folks might be experiencing, loss of savings, the inability or reduced capacity to meet their essential needs, and then just overall sustained financial hardship. And then at the social level, we know that socially, the impact of gambling-related harm can have an impact on those core relationships, whether it's out of dishonesty or the disengagement, and really the isolation. We know it's gambling disorder is extremely isolating. So they might be isolated from their partner or society in general. And then spiritual. So I like to also say within the spiritual aspect is the cultural aspect as well. So they might be experiencing cultural shame in relation to culturally based roles and expectations. Persistent loss also might have an impact on their connection to community, whatever that might mean for them. And then certainly if they are in a cultural practice or do have practices that might be reduced by their behavior of gambling as well.
Quick question, Mallory, if you don't mind. We have a question of just, I think you touched a little bit on the cultural, but where would family systems and cultural values fall within these? And I think you mentioned cultural alongside the spiritual, but just that question around families and cultural values.
Yeah, and I think it falls somewhere in between the social and spiritual, right? And I think that's individual. That's going to be more so where that person identifies that cultural connection. So if it is to family, maybe that is social and those interplays on that relationship. But if they're thinking more cultural in terms of, you know, a religion or a belief system, that might be falling more into the spiritual aspect.
And is this a United States model or a World Health perspective?
That's a great question. I've only seen this as United States. So, yeah, that's where my resources have been, but I would hope that this is seen on a World Health, like through the World Health Organization. I can tell you I didn't get that information from the World Health Organization. This is more from US standards. So, and this is more of a wellness type of perspective, which that's a whole other conversation as well. Okay, so we are going to be shifting gears a little bit, and I am going to be talking about some public health theories and models. So really, the goal of public health is to protect and promote the health of all people in all communities. And we really do so by following and looking at these three core functions. So this is assessment, policy development, and assurance. So assessment is just how it sounds. It's collecting, analyzing, and making available information on healthy communities. And we know this step is important because it provides organizations with comprehensive information of the community's health status, their needs, assets, and challenges. And this really helps us to better curate plans and the resources that are needed to address the health issue. And then policy development is the using or promoting the use of scientific knowledge base in policy and decision making. And this is one of the most effective ways to improve health in communities. And we know this, right? When we're thinking about changes that we're making in communities through when we're, you know, working in with the SPIF and things, that policy really does drive decision making. So things of this nature might include conducting policy analyses, developing key community partnerships, and promoting and implementing evidence-based interventions. And then assurance. So insurance ensures that the findings gathered through assessment and policy-related research are effectively delivering resources and services to those in need. Yeah, so this is really making sure that people who need services are getting them, but also making sure that the laws and systems are being followed to ensure the well-being of the population. And we'll talk a little bit more about this in the next slide here. So this is another model. And this is one that, you know, Public Health 101, most folks who have taken a class like that have probably seen this. But I liked this model. I love this model. And when I started to get into prevention, substance use prevention, I saw the strategic prevention framework, or the SPIF, and it made sense because this looks a lot like it. And we do see a lot of similarities here. But you'll see that on the outer edge here, we do have those three core functions that help drive us through this process. So again, assessment is really the collecting that data from the population or specific at-risk population. Policy development embodies what we would also like to think of as capacity building, right? So this is informing the public through education and developing policies that address the public health problem. And this helps us to drive implementation. And then assurance is, like I said, it's thought of as like an oversight of the public health system. So in gambling, I'll just break down for assessment, policy development, and assurance. So for assessment, this might look like individuals reaching out to helplines or seeking treatment for gambling through our Better Choice program. And I know that for us, we noticed that young people were accessing the helpline and treatment services at a faster rate since the expansion in Connecticut that happened in 2021. And because of that, we have seen an increase in younger individuals reaching out for help. And the national data did show that the college population is at risk. So we have worked with colleges in our state to increase awareness of risks that are associated. And we do encourage them to, gamble responsibly, right? We want to look at that 95% of the population that may not really be experiencing harm quite yet. So policies at the college level, at least working with the colleges that we have, included making some changes to the student handbook. But, this is certainly an area that we could continue to improve policies to protect young people. So examples of this might be harmful messaging and the use of social media to promote gambling, whether that's at the state or the federal level. That is a interesting conversation too. But we know that the young folks that are in college or even high school are seeing those messages without, a lot of information about the risks that that do exist. So assurance. So laws that do already exist and partners that we work with at the state level. So we do work with DEMIS and we work with Department of Consumer Protection. And this is really to ensure that, at DEMIS, with DEMIS, we ensure that young people are safe. So also the legal online gambling platforms such as FanDuel and DraftKings do require an age verification through an individual's ID. And like I said, we do work with the Department of Consumer Protection to ensure the safety of individuals and how to keep those who are voluntarily self-excluded safe as well. So we provide voluntary self-exclusion as an option, better choice programs for direct treatment, Gamblers Anonymous, Gam-Anon, and we do this, through helpline referrals as well as resources provided online. And that's really what we're trying to do as an organization in general, is just to get out and let the public know about the resources that exist. So each organization, so DCP, DEMIS, CCPG, we all have data to evaluate these services to ensure that they're competent at meeting the needs of the population. And I know that was a lot, so I don't know if I should take a break and if anyone has any questions. Okay. All right. So maybe something more familiar for some folks. This is the Strategic Prevention Framework, or the SPIF. And this is really bare boned. And you will see overlap between what someone might be doing with substance use prevention and gambling prevention, because like I said, there are a lot of similarities on what folks can be doing. So really at that assessment level, we can be, or communities can be doing focus groups, adding questions to their student survey, or maybe hosting a community conversation about gambling. Capacity. So who needs to be at the table? Might it be an RBHAO? So I know they have gambling awareness teams. So maybe having them involved, or, someone at the state level, legislators. There's a whole lot of folks, and I mean, that's going to vary based on your population and the community that you're in. Planning. So these are things that so forming a subcommittee that really does focus on this work with gambling, and working with our community partners that were identified. Groups that can assess capacity to influence change, and then creating a logic model using data collected. And I know that some individuals who were in this training did the it's escaping me. Working with Dorothy. CADCA, there we go. I knew her name, Dorothy. Working with CADCA to where we started to create logic models based on populations that people identified in their region. And then implementation. So just a couple ideas. Gambling education in schools. You'll hear me say that a lot more in this presentation. sharing information with the community, providing trainings for stakeholders and community members, and then evaluation. So, using those findings to address future outcomes. So whether that's from a focus group, adding questions, or, if you're assessing gambling education in schools through an assessment, and then really providing administrators on the current efforts that are being done in your community. So this is another model. And this graphic is from the Community Toolbox, which is an amazing resource. I do have a resource page at the end of the presentation that has that, so folks can access that. But this is adapted from the CDC's model of the social determinants of health. And I like this one, again, because we do see some overlap and similarities with the SPIF. So just an overview of the social determinants of health. So these are conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems that shape the conditions of our daily lives. And these forces and systems include economic policies and systems, development of agendas, social norms, social policies, racism, climate change, and political systems. And research has shown that the social determinants can even be more important than health care or lifestyle choice in influencing health. And studies do suggest that the social determinants account for between 30 and 55% of health outcomes. So this model here really shows how they interplay with social and structural conditions. So there's some similarity, like I said, in the language of the SPIF, but really the difference is that the social determinants of health is the one factor in focus of many that could be contributing to a poor health outcome. And you'll see that equity lives within this model. Because when conditions for health are unequal, we see these as health inequities. And when these conditions are unjustly distributed, the result is health inequity. So when we effectively address the social determinants of health, we can create a healthier community and improve the quality of life overall. And we're going to be discussing the 5 domains, the social determinants in a little bit here. But I mentioned Healthy People 2030. So I just want to bring this back because when we are talking about the social determinants of health, Healthy People 2030, there are goals that are determined from the Department of Health and Human Services, and these are updated every 10 years. So this is a screenshot from their website, and it is important to note that this is under the health behaviors tab. So you'll notice that drug and alcohol use are there, but you won't find one regarding gambling or gambling disorder. And we know that many of these are connected and can coincide with gambling disorders such as substance use, tobacco use, physical activity, nutrition and healthy eating, sleep, violence prevention. So, just a little call out on Healthy People 2030. All right, so this is a video. It's only a few minutes long, and it just sets up the conversation with social determinants of health. I think I need to just back out of this and play it from here. And hopefully, you know what? I don't know if I shared my sound. Never did.
Hey, Dad. I wonder if we'll see anyone we know at the carnival today.
Daddy, that's my friend AJ and his dad.
Hi, Samantha. Are you going to the carnival too?
Yep, I can't wait.
Me neither.
Hey, AJ, look! That school is a lot bigger and nicer than ours.
Yeah, they probably don't even have to share rulers and markers in class like we do. And their playground looks brand new. A lot of things in this neighborhood look different from our neighborhood.
That's true, AJ. Some neighborhoods look different than others and have different resources too.
What are resources?
Resources are things like hospitals, schools, stores, parks, and restaurants. There are different types of resources in every neighborhood. Some communities have less resources than others, or resources that aren't as nice.
The types of resources in the places where we are born, live, learn, work, play, and worship affect both our quality of life and our health. We call these social determinants of health, and they can be grouped into 5 major categories. Economic stability means people are able to afford things like healthy food, healthcare, and safe housing. Employment or job programs, career counseling, and availability of childcare can help increase economic stability in communities. People with higher levels of education are more likely to be healthier and live longer. But some children live in places with poorly performing schools, and many families can't afford to send their children to college. Programs to help children and adolescents do well in school and help families pay for college can also help people be healthier in the long term. All people should have access to quality healthcare. Increasing health insurance coverage helps make sure more people get the healthcare services they need, like preventive care, including screenings and ongoing treatment for illnesses. Everyone should be able to live in a safe neighborhood where it is easy for them to make healthy choices. Safe and healthy neighborhoods have access to parks and safe sidewalks for walking and recreation, access to stores where healthy food is always affordable and available, and safe and reliable transportation. People's relationships and connections with family, friends, coworkers, and community members can have a major impact on their health and well-being. Programs and policies to help people have the social and community support they need are important for supporting health and well-being.
Yay! We're here! I'm glad the carnival is a resource we can enjoy.
Social determinants of health are connected and related to each other. Together, all of these things will help improve the overall health of people. By working together, we can help ensure everyone has access to the necessary resources and support they need to be as healthy as possible. Learn more, take action.
Okay. Let's turn back in. Okay. So that's the social determinants of health, and like I said, that was more of an overview of everything, and we are going to be going into more detail into those 5 domains that were mentioned. So here is another model of those 5 domains these are from the Healthy People 2030, and this is typically the subset that we consider. But I do want to note that if you go to World Health Organization, they also consider 5 other domains, and that they can also positively or negatively impact communities, such as food security, working life conditions, unemployment and job insecurity, structural conflict, and early childhood development. But we know that those 5 other domains that the World Health Organization has as separate ones fall within these 5. So just a little sidebar on that. So now we're going to dive a little bit deeper into each determinant and then discuss how gambling would be integrated into each one. Okay, so economic stability. So this typically refers to the link between a person's finances and their health, and factors can include employment, income, and poverty. And as I mentioned earlier, just addressing Paul's question, that there isn't a whole lot of US research on this and on this subject in general. But some of these studies, this information was pulled from studies out of the UK and Europe, and they did look at the impact of gambling and economic stability. So one of the studies found that the rate of gambling is higher in economically disadvantaged neighborhoods, and we do know that some of this might be due to the fallacy that individuals may be able to lift themselves out of poverty by experiencing a big win. It also might be due to stress. So folks that are in, a situation where they are, whether that's their neighborhood safety or if they are experiencing economic distress, they might also be using negative health behaviors as coping mechanisms, gambling being one of them. So I think it's important to understand that public health is not black and white, right? We know this is not a black and white issue. So something with a negative impact does maybe potentially also has positive ones as well. So some might argue that the economic advantage of gambling does create jobs, and it also can help to fund programming. But again, when we think about it as a health behavior, we know that there is a great negative impact, especially if we're not also addressing sharing the risk factors for the population. So education access. So education access influences health outcomes throughout the lifespan. It also indirectly impacts the access to quality of healthcare, employment opportunities that pay a living wage, and for folks to live in a safe environment. And remember that health equity is in the middle of all of those domains. And historically, opportunities for education or healthcare access has not been distributed among equally among different groups of people. And we know that children who are from families with a lower socioeconomic status are less likely to graduate from high school or go to college, which can impact their employment opportunity, which would be touching upon some of those points that were made in the last slide. It is also important to recognize that quality of education access is just as important as on health outcomes. So if people are not receiving adequate literacy skills, or it isn't being provided amongst many populations that speak other languages, those individuals may have a harder time seeking treatment or care when it's needed. And as a side note, this is an area that we've been exploring to increase our efforts so that so that all individuals really can receive the resources that are necessary to protect them against gambling-related harm. And this is not causal, right? We know none of this is really causal, again. So, but we do know that it does put individuals more at risk for engaging in those unhealthy behaviors, right? So gambling, like I said, being one of them. And education access in relation to gambling disorder does have greater ties to socioeconomic status. So SES has been shown to influence the relationship between mental health and problematic gambling, such as individuals with lower SES often have a stronger relationship between anxiety and gambling behaviors. So healthcare access. So the National Academy of Sciences, Engineering, and Medicine, formerly known as the Institute of Medicine, defines health or access to healthcare as the timely use of professional services to achieve the best possible health outcome. And unfortunately, many people face barriers that prevent or limit access to needed healthcare services, which may increase the risk of poor health outcomes and health disparities. And there are associations between individuals experiencing gambling harm and chronic conditions such as heart disease and diabetes. These conditions do require management from health professionals in order to reduce that risk of mortality. And another important aspect to consider within the domain of healthcare access is that folks may be less likely to access healthcare due to financial burdens that they may be experiencing. So the built environment refers to human-made structures and surroundings that influence overall community health and people's behavior. And this can affect many areas of health, such as activity levels, access to nutritious foods, housing quality and security, transportation, and even their contact with nature. And, anecdotally, I've spoken with folks with lived experience that have expressed that while in active addiction, they had limited access to healthy food options or, simply didn't pick them, maybe because of financial burdens. But, when we think about the casinos, right, they may not be the healthiest options there, but then you also add on the burden of how much things cost when you're at the casino. I mean, what would be an average price somewhere else, but inside the casino, it's, escalated. The prices are much higher. And, quality over how expensive things are. Just thinking about that. And similarly, we can think about access and what was made available to communities that impact negative health outcomes. We can talk about the access to online gaming and physical proximity to casinos. So it used to be said that if you lived 50 miles from a casino, you were at risk, or your risk for problem gambling increased. So since the expansion, we know that that's, increased for everyone because they have it right in the palm of their hand. And this might also impact an individual's time spent outdoors, whether that is, if someone's doing it on their phone or in a casino. That also, again, would have a direct impact on their physical activity levels as well. And then transportation is really interesting. It's a little bit different to think about, but we often think of the increase of transportation as a positive outcome. But when we think of where we're increasing transportation options to, we can also have the discussion of harmful outcomes. So a really great example of this is providing casino shuttles for the aging population through senior living. So, we're increasing the opportunity for recreational activity or to get folks out, but, bringing them to a place where they may be experiencing harm or, without, again, the education of being able to identify if they're at risk. Just thinking about what we're offering and what we're making available to folks and the potential on the health outcomes. And social and community as a determinant is defined as the relationship and interactions we have with family, friends, coworkers, and community members. And these relationships really help to foster the social support that we need to live, learn, work, play, worship, and age. And when considering negative health outcomes that can impact gambling harm, we can discuss some of the known risk factors that I was mentioning earlier, like having a family history of gambling addiction. And if a community does not have available programs to help individuals who are experiencing harm, it could further exacerbate the issues. And I think the biggest one we can talk about in terms of this determinant is community norms. And I really think that speaks volume in gambling and how we can address this as a public health issue. I think that's why I'm giving this presentation in general, is because I think even society, when we look at, not just our communities based in our state or where we live directly, but at the federal level, right? Like, we're not seeing this maybe as a public health issue, because I think that there are norms that exist. And we know that folks maybe aren't talking about it in the same way, and that it is viewed often as socially acceptable without risk. So yeah, it's a huge impact on this determinant. All right, another little break in case people had any other questions. Okay, so this is the social ecological framework. Might be familiar to some of you who are working in prevention. And in terms of gambling, I broke it down with, that individual level, those interpersonal relationships, community, and society. And sometimes on the there's, different iterations of this as well, where there might be a macro level of thinking about like that system level. But for the individual, this might be conducting education programs or trainings to help inform at-risk populations of gambling-related harm. At that relationship level, this would be educating parents and families about problem gambling. At the community level, it's working with those community leaders to really disseminate awareness campaigns. And then that societal level, this might be advocating for gambling education to be integrated into an existing health curriculum for youth. And like I said, you're going to hear me say that a lot. And I would love if folks could do that. But I do think that it's worth mentioning that this model and approach could look different depending on the identified population, including regulations regarding education and gambling, expanding treatment options and screening opportunities in healthcare settings. Like when was the last time you went somewhere to a doctor's office and they asked you about gambling? Probably never. And then, like I mentioned, that system level. So how could we even be informing emerging professionals? So individuals that are going to school to become clinicians, letting them know about gambling and considering gambling certification so that, I know in Connecticut, it's not, it's a gap across the board as far as having available treatment for folks. Connecticut is better than most. I think I was at a presentation a couple of weeks ago, and an individual from Texas was sharing about the opportunities that exist for treatment or for resources in their state, and nothing, not much. So how could we be expanding that either at the state level or at the federal level? Yes, Paul.
Sorry, my unmute button isn't working very well. So I don't know if it's how relevant this is at this juncture of your presentation, but I guess the community and relationship brought it to mind. So working with young people, young adults, college age, at first I thought it was a little bit of a fluke or something, but it's not. Young adults with sports betting, they just don't believe it's gambling. They believe it's much more related to skill and information, and that's relatively new and unique. So back in the day when it, let's imagine 20, 30 years ago at the racetrack, was it similar? Well, yeah, it was similar in that the more information you had, the better odds you had, right? If it wasn't fixed. But present day, not only has the technology accelerated the accessibility and the type of gambling, but also the technology has provided information at our fingertips. And added to that, the enmeshment of relationships around the activity, it's unprecedented. And I'm just wondering out loud if our language is antiquated. That's it.
Yeah. I couldn't agree with you more. And I do think that, this is emerging, right? Like this is all happening and changing right in front of our faces. And we're trying to keep up with it, right? Like I think that it is an opportunity for us to look at that and look at it from that lens, because I can speak anecdotally that I have friends that will argue with me about, oh no, if you just are good enough at statistics, or if you can beat it. And again, for those of us who work in this field and understand that, we know that that's not true. Or it will catch up to them eventually, right? So yeah, I do think that is, oh, Val, yes, I'd love your opinion on this.
No, I don't want to. I'm going to say something very short. I have a lot of opinions about that conversation, but I don't think it's so different than what happened with poker 20 years ago, online poker. It's the same mathematical realities, and it was kind of the same population in a lot of ways. So, this isn't new, although it's an old problem, Paul, and it is a problem. The skill versus luck. So, and I can't bite my tongue here and say, if you don't think that's gender-based, then wake up. Because, women don't know what they're doing and they play slots, and men are so smart that they only gamble in ways that, skill matters. Not true either way. But I also want to say that I was with Kelly Houston. Is it Kelly?
Kelly Houston, yeah.
Houston
Wonder
works for
Nation.
Wonder Nation at Foxwoods. They are the online. They relate to DraftKings. Like they aren't DraftKings, but they are connected to DraftKings. And she said to me, when I asked, she's like, "Oh, you have the amazing capacity they have to develop odds has nothing to do with somebody being good at statistics, Mallory. It has
No, I know.
their math is so far over." And I think that that's part of the educational system with young people. It's like, understand that what's antiquated is our view of how we even come up with odds, right? Like we need to understand how sophisticated modern gambling, gaming, by any name you call it, is, and that it really truly needs to be relegated to entertainment, period. Like that's my opinion only, but it's like to educate people, like this really is only entertainment, because there's a certain segment of the population who's not going to believe you anyway. But if we could just hit enough people, enough young people to understand exactly what they're up against, then it would parallel the rest of their life experience, I hope, which is, they're in a world where this is where everything, like AI and what's going on online, is their world, and they have to learn to respond to it. That's my opinion.
Yeah, no, I actually was going to mention, like those other skill-based games that people have been, talking about for a long time. Yeah, it's on both ends. And actually anecdotally, like people have said, folks that do sports bet and they're, oh, it's, statistic based, but then saying, but I see where you could get hooked in on those online blackjack, so, online poker. So, it's very interesting, to consider. And then, where this falls in. And I think, like Val said, it really does come back to how we educate and letting folks know about the odds that, and there's documentaries and stuff out there, even like slot machines and how those compute and make odds. And it's just, you can't really argue. You can't really argue that, it's not in the person who's gambling in their favor.
And if I could add one more thing for Paul, because I hope he's gonna get this. Having been in a lot of Gamblers Anonymous meetings in my life, I can't tell you the number of times I have heard someone say, "I'm the smartest person in the room." And I really, truly think it's a gambler's fallacy. I think it should go with all the other cognitive distortions that happen during gambling.
Anyone else or any other thoughts? So this is was a really nice little segment to get us into another little video. It's like 2 minutes long. I will just have to back out again. And this is about the upstream approach. that's, sometimes videos do a better job at explaining things. That would be really hard to explain. I always like having a visual for that. So here's another visual on how we can look at the upstream approach. And you'll see that some of the tactics at that upstream level would be laws, policy, and regulation. So again, when you think about that macro level for gambling, this may look like making a state policy to include gambling education in middle school and high school curriculums. And it also may look like regulations around advertisements. The use of harm reduction strategies, that does fit in here somewhere. That can be discussed a little further on in the next couple slides when we think about the continuum and considering prevention. And then at that midstream level, this may be addressing a treatment desert. And this may also be improved by thinking of that upstream approach. And so in this level, this would be we'd also see programs being implemented for certain at-risk populations. And then really that downstream. So these, again, interventions that exist for that individual already. So there's also an opportunity here to highlight for the gap for interventions for some people. And an example of this might be youth. So we know that youth can't necessarily access gambling treatment because of parental consent. So how do we address that, and I mean, that's a whole other discussion, but, just as a way to, like I said, highlight some of those interventions that should exist for at-risk populations. Okay, so the continuum of care model, I do want to just be sensitive on time. I think we might be able to get the breakout in. This is probably, again, a review for folks, but just want to point out that in order to fully understand prevention, you really do need to understand the whole continuum. So we really do also need to know what treatment options are available, what recovery pathways are available when we are working in that prevention area. And then this next continuum. So this is similar to the gambling continuum that we saw early on in the presentation. This one is from Ontario. And I think it does a really great job of breaking down prevention. So showing it that primary prevention, secondary prevention, and tertiary prevention. So, and we can really think of primary as universal, that secondary as selective, and tertiary as indicated. And so primary prevention would be preventing gambling related harm before they occur. So these individuals are likely not gambling at all. Secondary prevention may be, the gambling related harm might be in the early stages. So this individual is participating in behavior maybe initially as recreational, but then maybe crossing over those boundaries into that harmful category. And then tertiary prevention. So again, working with an individual who is experiencing that gambling harm and doing our best effort to then increase those treatment services and support. Okay, so addressing gambling disorder. So I've mentioned a bunch of suggestions already throughout this presentation. But again, if we're looking at that continuum and looking at prevention, treatment, and recovery, so prevention, we can be increasing our efforts by use of awareness campaigns about gambling risk and potential harms. We do this with the Responsible Play, the CT Way campaign. We'll talk about that in a bit. And then also promoting our CCPG helpline, educating youth on gambling, just like we do with other substances. And then creating policies to reduce harmful messages. So we're trying to work on that. That's, I think, a legislative agenda, on our legislative agenda, or we're trying to get it there. For treatment, this may look like integrating gambling in treatment facilities that are treating comorbidities. So this is also being done in Connecticut through the Dig In program with substance use. We also can see an increase, or we could also be increasing our efforts with screening. So like I mentioned, when was the last time you went to a doctor's appointment and were asked about gambling? training. So training more clinicians to treat individuals with gambling disorder, as well as diversion programs. So that's a whole other conversation as well. But really, this is, we know that diversion programs exist for people that might be experiencing crime related to substances, and they could be getting treatment. That doesn't necessarily exist for gambling. So how can we be increasing our efforts there as well, so that folks aren't just receiving that punishment, looking at a crime and going, being incarcerated because of it. And then in recovery, this may look like raising awareness of available resources and pathways of recovery that exist. So Gamblers Anonymous podcasts are one that many people forget about. That is wonderful. Smart Recovery, among some others. And then responsible gambling, I did mention this a little bit as far as that continuum. And we talked about it, I think, when Val was bringing it up, but really, like, again, teaching people about the odds. I think that isn't necessarily on here, but that's one that we would want to do. You know, setting a budget, time limits, taking breaks, making sure that this really is for entertainment. And then, oh yeah, the odds are on there. You know, not checking in with your mood when you're gambling, limiting substance use and alcohols, and then really being able to balance other activities outside of gambling. All right. Okay, we made it. So breakout, I'm just gonna give, I don't know, we can do 10 minutes probably. And then, so I don't know how, Jen, you want to break this up, but take a screenshot of this if you want, just for the questions that you'll have, and not really requiring people to come back and report out, but if you have any thoughts afterwards, we can share for a couple minutes.
Yep, so I'm going to create some breakout rooms. We'll go in for just about 10 minutes or so. Just put random people into rooms. And if you want to take a screenshot or jot down those questions, just so you remember, I think Mallory might not necessarily ask everyone to report back, but get a general sense when we return about what some of the comments were in your breakout session. So I will send everyone in, and we'll see you in a few minutes, everybody. Thank you. Does everyone see the rooms? There we go. Great. And then Mallory, Kelly, and we usually stay out so that people can talk. Paul, do you see your room? There he goes. Okay. All right. So it didn't ask me for a time, actually, for some reason. So shall we just say 11:49?
Yeah, I really don't have many slides after this. It's just about the CCPG initiatives. So I think we're like going to hit it perfect.
Okay, we're recording, so we're recording still, remember. So yep. We will come back at 11:49 and pick that up.
Sounds good.
All right, see you in a few. Bye.
Thank you. Are people are just coming back now?
We're coming back in. I can see.
Right.
We have about 20 seconds to come back out. And then Mallory, if you'd like to invite anyone to share if they'd like to.
Yeah. Yeah, so if there was anything that came up that folks wanted to share quickly, feel free to.
Okay, everyone's back. Mallory, go ahead.
Awesome. All right. Yeah, I didn't know if there was anything that came up that, you know, if anyone wanted to share, they're more than welcome to.
I like the awareness that we brought to the table about how our teenagers are not really looking at this like a gambling problem. They're just looking at it as a skill, like you guys had mentioned earlier. And they're just looking at it as okay, I'm having fun. That really was an eye opener to me.
Great. Thank you. Anyone else?
Yeah, I have to go there, guys. I have to so I talked in our group about not youth, but young men who are married, they have families, they have mortgages, they have decent jobs. They're friends maybe with a lot of people who might be, you know, in this training. And it's really pervasive. And, you know, Kelly pointed out, it's not really a primary prevention message, but it is a responsible play message because it's a really, really large population that's hard to reach from a health perspective, but that is really the heart and soul of who's spending a lot of money doing this.
Mm-hmm.
Yeah.
I agree.
Thank you. All right. Last chance if anyone wants to jump in. I've got a couple more slides that I want to just make sure that we can get to.
Rather, I'll add a quick thought.
Sure,
Paul and I had a
sure.
really nice discussion about just special populations that we should raise more awareness to help know that services are available within the LGBTQ plus populations, seniors, incarcerated individuals are within the criminal justice system.
Yeah, definitely. Absolutely, Fred. And I'm glad we are, you know, we are trying, and I know Haley, I think Haley's on this call and working with special populations. Definitely need to consider them as we're doing this work. Great. Well, thank you everyone for participating in that. Here are just some of the initiatives that CCPG has been doing. So I mentioned the responsible gambling campaign, and I know Val just mentioned it, responsible play. So this messaging is really to be reducing the risk of harm that might be, you know, for that 95% of people that might be recreationally gambling. This is really the messaging that we want those folks to be seeing. Yeah, we've been running this campaign all over the place. You would see it hopefully at the bottom of any commercials for, you know, the lottery, and for our partners at the bottom there for the industry, for Foxwoods and Mohegan as well. And then I mentioned colleges. So we do have a college campus initiative, and activities have included a lot of the stuff we've talked about. So they've done focus groups on campus. They've disseminated surveys to students, screening opportunities to students. You know, I did mention that a couple of them did change policies to their student handbook. And then all of them have distributed educational materials to the students on campus. And then last year we had 8 colleges participating. This year we have Southern, Gateway Community College, Norwalk Community College, Sacred Heart, Wesleyan, Bridgeport University, and Providence College is kind of our outlier, but they're also participating as well. And we are running the program this year and then next year as well. So we really do hope to continue those efforts on college campuses to raise awareness. Yeah, sure, Paul.
I was just wondering if there's a way to extend that reach to parents.
Yes, and that's actually interesting that that did come up in conversation with Wesleyan. So, you know, they were talking about how can we, like, thinking of the persons affected, right? Like the outside of just the individual, the family. So, yeah, are there opportunities to be talking to parents? You know, it's interesting at the college level of like, where does that autonomy of going off and being independent, and where the parents you know, are and are not included in conversations. But potentially, I mean, myself and my own personal opinion is that there's an opportunity maybe within like an open house for freshman orientation. Is there an opportunity to have a discussion there where parents might be at that, you know, with their students that are going to that college? So definitely an area that we want to keep expanding and growing, and you know, working with this population, because like Val was saying, it's not just college students, or, you know, it's young men. And, you know, certainly we want, when we're thinking about prevention, we want to be addressing it before it becomes a problem.
And for the college to understand why they can be affected, right? So
Right.
a real-time example, last night at the GA meeting, I learned of a student at Trinity College, an athlete on a scholarship, was so indebted, parents paid it off. He couldn't stop gambling, and he's no longer a student. So the colleges are losing out as well.
Yeah, that's a great point.
They're
Yeah, and I mean,
they're stakeholders in this.
right, absolutely. Yeah, and it's that has been a difficult, I think it's been a barrier for us, is having the colleges really invest in that and know that looking at it from that lens, I think, like you were mentioning, is really important, in that the safety and health of their students is going to have a direct impact on their, you know, the percentage of folks that finish college, right? So, and they definitely care about that. So, yeah, that's a great point. And then book the resource van. Again, if you've been to any of these trainings, we talk about the van a lot. This is with our partner, Stephen Matos from MCCA. He goes around and pretty much brings this van everywhere. It's been on farmers markets, colleges. It can go to a coalition meeting or other events that you have. And on the resource page, I did put the link to go directly to the calendar for the van, so that you can book. But it's great because, you know, it's handing out information. We can do screening events there as well. And then people can voluntarily self-exclude if they want to at the van. And speaking of resources, here they are. When I send out the PDF to, or when I give it to Jen and she sends it to you all, I believe you'll be able to just click on these and it will bring you right to the page. Yeah, these are a lot of the things I used today or mentioned throughout the presentation. And yeah, that leaves us with like a few minutes for questions, but I know we've been having good discussion throughout. So yeah, not sure if anyone did have any questions. Just really quickly before I bring up the next slide has the QR code for the survey for the evaluation. Sure, Haley.
Yes. Well, first of all, amazing presentation. Thank you.
Thank
I
you.
loved all the videos too and everything that you shared. I was just going to add in our breakout. Kathy had mentioned, and we were just talking about even just relationship building is so key, especially when reaching out to special populations and underserved communities, because there can be that distrust of, you know, government systems or organizations. So, and, you know, it can be tempting to sometimes just drop off flyers and then hope that they put it up. But I know that, you know, building a relationship, inviting folks to the table for the gambling awareness teams also, and really checking back in. And like Kathy had even said too, it's just even like going to coffee and talking about things other than work related or going to lunch. So just taking the time to build relationships can be really meaningful and making an impact, as we all know too.
Yeah, thank you so much for bringing that up, because that is an area I left out, is the distrust that some populations would have for the medical and for some of what I mentioned with some of the systems that exist. So
before we wrap up and everyone hops off to lunch or to your next work endeavor. Just wanted to first thank you so much to Mallory for bringing this presentation. I'm so incredibly grateful from looking at this from a different lens, and especially as we know that all of our communities and coalitions or LPCs are working on disparities and health disparities and really trying to get into subgroup population data. So this is super helpful in framing that conversation and giving us some models to look at around those endeavors. So if you wouldn't mind, there is an evaluation survey link or QR code that you can just put your phone up to. I will also include it in my follow-up email to you. So I will be sending you the presentation slides as soon as I can get those from Mallory. I will email that to you with the evaluation link as well. And then later in the week, I will be sending you your CEUs in a separate email. So you'll be getting all of this information and your certificates later in the week. So thank you so much for your time today, everyone. Be well, and thank you for engaging in this important conversation going forward in your communities and in our state. Be well, everyone.
Thank you, everyone.